Good morning, it's Tuesday. Today is my surgery day. We're going to see the patient. In preparation for the surgical procedure, we've seen the patient in consultation. And today we'll re-review with the patient the surgical procedure. I typically will begin my day with a brief workout and review the surgical plan the night before the surgery. Today we have 3 surgical procedures, 2 of which are reconstructive surgical procedures following removal of tumors, one of which is with one of my colleagues, Dr. Perry. In addition, we have a breast reduction. We are all now in masks due to the COVID mandates, trying to protect both the patients and the staff. Into the locker room. Good morning.
Good morning.
Hi, did Dr. Perry see you?
Not yet this morning.
Okay, you all set?
Couldn't be more ready.
Any questions you have, I can answer. So I'll see you in a little bit.
Sounds good.
Thank you.
Thank you.
It's the day, and then got a couple consults to go see.
Okay, very good.
My name is Joe Wilmette. I'm a vascular surgeon at Calvert Health. So I got here today probably around a little before 7, and today for me was a day doing mostly dialysis access surgery. So that's something in our community where there's a really big need, because we have a lot of patients that have end-stage renal disease, and they require an access to be able to do dialysis. I'm about to see my next patient who also is in need of a dialysis access. His veins do not look great, so instead of using his own vein, we'll have to take a piece of graft, which is an artificial kind of synthetic material, where we'll sew one end into the artery and then one end into the vein. And through that tube that's now under the skin, they'll be able to access that in a month or a little longer to do dialysis. As a vascular surgeon, there's a pretty wide variety of things that we treat, and a lot of it we can do here at Calvert. A lot of things that previously people may have gone up to Annapolis or to DC or Baltimore, but as time's kind of gone on, we've built up our expertise and ability to do different procedures. Some of those things include treatment of aneurysms, carotid artery disease, peripheral arterial disease.
Good morning. I'm Ramzi Alami, the newly hired bariatric surgeon here at Calvert Health and Director of Surgical Services. I'm happy to say it's 9:20 in the morning. I had to have breakfast with my kids today, and I'm coming in to do a sleeve gastrectomy. This is actually our second bariatric procedure here at Calvert, and I'm very excited. Today's patient is a 62-year-old gentleman who is morbidly obese. He needs to lose about 150 pounds. He's got multiple medical problems because of it and has been struggling with weight loss for a long time. So the plan is to proceed with what's called a sleeve gastrectomy, an operation where we remove about 80% of the stomach, helps the patient lose a lot of weight very quickly and maintain the weight loss. I've known this patient for the last 4 months. He's gone through an exhaustive program with us in terms of evaluations, making sure he's ready for this procedure from a physical, mental, and psychological standpoint. I'm going to go in, see the patient, make sure that he is all set and ready for surgery. Morning. The day is here.
Yeah.
How are you feeling?
Great.
Great?
Yep.
Ready to go?
Mm-hmm.
Any last questions, last thoughts, anything like that? Did you get a haircut?
Yep.
Oh, new beginning. I like it. All right, they're just getting the room ready for us. I'm
Okay.
going to go get changed and we'll get going.
Sounds good.
This is the part where we make sure that all the documentation's in order. I've already gone through all of his orders and made sure that everything's okay in that sense. And here we go. Shanae, you got everything you needed, right? And you're giving him the heparin? No, I checked them all in the clinic, so everything's good from that standpoint. We just need the heparin. You got that? Perfect. Thank you. Morning. All right, how are you? Started out with Calvert in May. There's a huge need for bariatric surgery in this area. We have a very high obesity rate. About 38% of the population in Calvert County is obese. And with that go a lot of medical problems that include heart problems and diabetes, blood pressure issues, cholesterol issues, and so on. Bariatric surgery has been around for a long time and has been proven to be an excellent solution for a lot of these patients. So we started the program. It's a multidisciplinary program that involves making sure that the patient's fit from every aspect. And so they typically have a lot of visits with the dietitian, psychologist, before we get into the operating room. And in this gentleman's case, I've been seeing him since late May, early June. He was actually referred to me by the plastic surgeon, Dr. Ermentraub, because of a very big overhanging pannus, or the abdomen sort of sagging. Makes it difficult for him to walk and move around. Rather than do anything with that, the easiest thing to do is to go ahead and perform, or the safest thing to do is perform the bariatric procedure, have him lose a lot of weight, and then deal with the pannus. So let's see, we are, I believe, in room 4 today.
My name is Ted Sangaris. We have one new patient with an early breast cancer who I have not seen yet. And then we'll see her, we'll talk about her disease and her presentation. Later on, I'm going to be going over to the hospital, and I'll be visiting with plastic surgery Dr. Ermentraut and a patient he has there that we're consulting with.
Good information. Thank you so
See you in
much.
3 months. You're welcome.
You will never know when I knew I had it again, and I kind of thought I did.
Mm-hmm.
I wasn't as scared this time, but when I talked to you, you made me feel more comfortable about having this surgery
Well,
done.
you're very sweet. Thank you. But you've been through it before. You were a pro, so you knew all about it. You have any questions?
I'm good.
Okay, so don't worry about the medicine.
Okay.
Let's just move on through, and then we can always revisit it.
So getting ready for my 4 cases for today. Today we're going to be doing removal of a lipoma from a woman's shoulder. She's had for several years, causing pain now. Hopefully we can get that removed and making her feel better. Taking out a couple patients' gallbladders, and then after that I think I have a port to put in for a patient who has a newly diagnosed cancer, so she can get on with treatment and get her feeling better as well. Working with a great team here at Calvert. I've been here almost 10 years now. Everything's going well. The team's great. Working with everyone. Everyone works as a well-orchestrated team here. Got assistants, have nurses in the operating room, surgical techs, all have a lot of experience and work well together. How are you, Mr. Grennan? How are you? All right, there will be written instructions about dressings, activity, medication. Everything is written down. Low-fat food, okay, for at least the next couple weeks, and then you can start to reintroduce stuff. Very good. I will call you as soon as we're done, let you know how everything went. I'll see you back there in a little bit. Very good, you're welcome.
My name is Dr. Assad Suwaid. I'm a therapeutic endoscopist, gastroenterologist, and today I have a busy day here over at Calvert Health Medical Center. I actually started here only recently. This is my second month, and I'm already getting used to the system here. And today is a typical day for me, which means that I'm on my way to the OR to do my procedures. And after that, I do have a busy clinic, so it's going to be a busy day. I'm on my way to the OR, and in the OR, we're going to be doing 3 procedures, 3 endoscopic procedures. And the 3 endoscopic procedures are going to be done on 2 different patients. And they will pretty much represent the type of work that I do as a therapeutic endoscopist. The first procedure is an endoscopic ultrasound with fine needle aspiration. And this is the OR, so I'm going to be checking into the OR. Good morning, ladies.
Good morning.
Morning.
Good morning.
Okay, so we're going to be heading. Today, I'm going to be doing a procedure called endoscopic ultrasound with fine needle aspiration. And this is a very high-tech procedure. I think this is the first time it's being done at Calvert Health. What we do is we go with the scope down to the stomach, and this cyst is in the pancreas, so it's located behind the stomach. So we can use an ultrasound scope. By that I mean a scope that we can use the ultrasonic waves to look behind the walls of the stomach to look at the cyst, and when we see the cyst, we can pass a needle through the stomach wall into the cyst, aspirate some material, and send it over to the lab for pathologic evaluation, biochemical evaluation, so we can tell the patient if this is something that needs follow-up, if this is something that needs surgical evaluation, if this is something that she doesn't have to worry about for the rest of her life. Hello, good morning.
Good morning.
How are you today? It's Dr. Suede.
Yes.
How's everything going?
Pretty good, I think.
Good, good. Good morning, sir. How are you doing? So, are you ready?
I hope so.
We're gonna give you some antibiotics before the procedure. They're gonna be running in your vein. After that, we're gonna go to the OR. The anesthesiologist will see you, and we got the clearance from your cardiologist, which is great. And after that, we will do the procedure, and then we'll discuss the findings after the procedure. So, any questions? You're good? You ready to go?
I'm supposed to.
Okay, great, great.
Ready as I'm
So,
supposed to be.
great. So I'll see you inside room OR3.
Okay.
All right, all right. Take care.
One of the most important parts of the surgical team is the nursing staff. So the doctor's part of it, but the nursing staff helps keep everything safe. And once again, we have one of our nurse anesthetists here who will help anesthetize the patient, get them safely through surgery. We have a lot of complex looking devices here that are used to monitor the patient for safety.
Hey, it's gone. Ready? Mm-hmm. Good. Ready? All right. We got a great crew set up for you here. All right. Let's see. How's the music? Yeah, music's good. There's a lot that goes into one operation, as you can see. It's a lot of people making sure that everything goes well.
Is there? I like the screen to be big.
Okay.
That's okay. That doesn't matter. This is like a big cyst. It's not like a fine T1, T2.
Any strap on you that we talked about, okay? All right. So no jumping strap.
So the first part of the surgery is getting our access. These are called trocars that we put in to allow us to exchange instruments and put our scope in.
So this black image is the cyst that we can see. Can we magnify the view please a little bit?
That's good. A little bit of tilt towards me and a bit of table up, please.
It's coming, but slowly, and that's the largest needle we have, and we're beginning to get more samples, but it's very thick. So we have probably close to 7-8 cc's, which is more than enough. So I'm gonna just, okay, try to get some towards the wall. See, I hit the wall, Tina, see the wall? Doppler, please. So that's the left atrium, and we can see the pulmonary artery next to it. And we're moving out. Again, this is the bronchial tree. We're out all the way up in the neck. We saw the azygous vein. These are the carotids. We're way out, and the procedure is over.
So surgery was successful, and we're going to go meet with the patient's family next and do the post-operative discharge for the patient.
Sample that we took, and it looks very mucoid. It's like jello. So the diagnosis is pretty much established. I just want to check some cells, and this is mucinous cystic neoplasia. Then we'll have to make a decision regarding surgery. This is pre-malignant, not a cancer, pre-malignant. So given her age, we have to take everything into consideration and decide what's the best thing for her, depending on the results.